Good evening, everybody. On behalf of the NYU Meyers Alumni Association, I would like to welcome you to another Meyers Marvels event. I am Fidel Lim. I am the president-elect of the NYU Meyers Alumni Association. And NYU Meyers College of Nursing is committed to producing lifelong learners who will excel in their nursing careers, excuse me, and be recognized as leaders who keep patient-centered care and the health of society at the forefront of their values. And Myers graduates hold positions of leadership in the profession, practicing in diverse clinical, academic, and administrative settings. The Myers Marvels series shines a light on our most prominent alumni that have influenced the nursing profession. And tonight, we are very thrilled to speak with Dr. Elizabeth Ayello. And here I go off script. Dr. Ayello was my mentor when I was a new faculty in the making. I was doing my practicum with Elizabeth Ayello here at NYU in the 90s. And I didn't tell you this, but Elizabeth, I have your notes from 1993. I saved them all in folders. It's in my, I have it here. And what I'm holding right now says abdominal perennial resection, which you lectured so well. And you really, back in the days before we had all of these snazzy things in the classroom. So I owe a lot to what I do in the classroom to learning from Dr. Ayello here. So now on the script. So Dr. Ayello is a board certified wound and ostomy nurse. She is internationally known as an author, editor, researcher, clinician, mentor, and consultant, and educator. She is currently co-editor-in-chief for the international interprofessional journal Advances in Skin and Wound Care. She is faculty for the Interprofessional Wound Care course and president of her Nursing Consultant Corporation. And Dr. Ayello is immediate past president of the World Council of Interstomal Therapists and their journal's executive editor emeritus, which under her leadership became the only wound care journal regularly published in 5 languages, and that's English, Chinese, French, Portuguese, and Spanish. She has extensive experience teaching in the USA and globally. She has over 200 peer-reviewed journal articles and several books. A past president of the National Pressure Ulcer Injury Advisory Panel. She's headed the task force to change the stage 1 definition to be inclusive of persons with dark skin, and is currently a member of the global group writing the evidence-based 3rd edition of the International Pressure Injury Prevention and Treatment Clinical Guidelines to be released next year in February. This event will be moderated by Dr. Sharon Wexler, and Dr. Wexler is the president of the Meyers Alumni Association and serves as professor for the department chairperson at Pace University College of Health Professions. So, Dr. Wexler, on to you.
Thank you. Good evening, everyone. I'm thrilled to be here today, and I have the honor of talking with one of my mentors, Dr. Elizabeth Ayello, and I also had the honor of presenting Elizabeth with the Distinguished Alumni Award at the NYU Alumni Weekend just about 2 or 3 weeks ago. Elizabeth, once again, thank you for everything that you've done for me. I would not have, I'm not sure I would have finished my PhD if it weren't for your encouragement and friendship. So I'm thrilled to be here tonight. So Elizabeth, can you tell me what's your proudest contribution to nursing? What are you most proud of?
That I'm still standing after almost over 50 years as a registered nurse and still able to make a contribution to our profession. And that somewhere in the world, there are people that still have their legs, because people who I have taught have been able to early identify people at risk for diabetic foot ulcers, which then can go on to amputations. And I am very, very, very proud of that, because once you lose your legs or part of your legs, the death rate is very high. 50% will be dead 5 years after the first amputation from a diabetic foot ulcer. So it just helps me to sleep well at night.
Thank you. Elizabeth, almost everything that you've done is interdisciplinary or interprofessional. You were doing interdisciplinary work before people recognized its importance and before it became the thing to do. What do you believe is the key to building effective collaboration across different fields?
First of all, be born a middle child, because you learn the skill of collaboration very early on, and how to get people in a team and work together. So I think that's a good start. Yes, I was an early graduate of a clinical nurse specialist program here on Long Island from Delphi University. And when I was able to get a job, and it was very hard to find jobs in those years, because there weren't a lot of master's prepared clinical specialist roles. But I'm very, very proud that in 1976, I was able to convince the hospital to have the first, for that hospital, nurse-run outpatient service for diabetes, which was interprofessional, because we really wanted to decrease the amputation rate and have better outcomes, as well as a nurse run, which, think about this, in 1976, outpatient service for people with ostomies and wounds, to help improve their quality of life and to rehab after surgery. I have to laugh, Fidel, because I'm sure those notes that you have are probably not even correct anymore, because we've had such great strides in surgical care and techniques. And of course, people used to be in the hospital 2 weeks after that surgery. Now you're lucky if they're there 5 days. So just to show how evidence and knowledge changes, and how you have to constantly keep learning new things.
On a personal note, Elizabeth, I have a set of notes from you as well. When I served as when I was your research assistant, graduate assistant at NYU, and you were doing a national wound care study, if you remember that,
Yeah,
right?
yes, I
And
remember.
I met you at your home, and around your dining room table, you gave me all of your tips for success when you were doing a research study, and how to enroll patients, and the best way to approach people for consent. So that's one chapter. Another chapter was on writing grants, that you
Yeah.
gave me a lesson on that. So I have to tell you, I still have them, and they're still pertinent. And when I work with my PhD students, I still refer to those things. So Fidel, you're not the only one that saved Elizabeth notes. So yeah, so we both have pieces of your history. So that's a nice segue, really, to the next thing I'd like to talk with you about, and that's about mentorship. So mentorship has played a very big role in your career. Can you give us some pearls of wisdom in mentoring others in the nursing profession? You do it wonderfully. Can you share some of those pearls of wisdom?
Well, first of all, thank you for those kind words. And I think I've been very fortunate in my life that the right people came at the right time into my life to teach me skills and things that I needed to learn and to know. And probably one of the, uh, and they weren't always nurses. And I think that's something we as nurses need to do a better job of, is mentoring the next generation and those that we work with. And I had the chief of surgery who mentored me as a new clinical nurse specialist because he wanted better care for his patients. And, I said, okay, let me come in the OR. I want to see what you're doing. I want to see how you're doing stuff. I want to see how you take the ostomy sites that I'm marking and how you really use them and how your decision making is, because we need to work together as a team, because post-operatively that will impact on patient outcomes. So I think that being open to relationships with people, you have to have a trusting relationship, and it's not hierarchical. I mean, everybody was on the same playing field in my interprofessional teams and in mentorship. And every idea was good. And we talked about everything to figure out what we could do better for patients in the care setting, or if we were writing a manuscript. It wasn't just the first author whose comments carried the most weight. Everybody had equality in terms of, okay, here's our outcome. What do you think we need to do and why? Give us a rationale as to why we're doing it. But probably the woman who changed my life the most radically was Dr. Roberta Aberzizi. She was an amazing woman, and she took me as a clinical nurse specialist and said, I want you to come work with me. I have this new journal which she had created, and I need somebody who's knows clinical practice and probably can write well because you're just finishing up your master's degree. And then you're going to go on for your PhD. And I said, no, I'm not going to go on for my PhD. And I was wrong about that. And she taught me things. But the most important thing that she taught me is to give credit to everybody on your team. And your success is the result of a lot of people that may not be visible. Listen to everybody's ideas. She said to me, like, I remember once she got an award from somebody and she dragged me along. And as they were giving her the award, she said, no, Elizabeth, you need to stand here with me because you had input into this award. You helped make this happen. And I said, but no, it's your award. And she said, no, it's our award. It's our award. Come into the light with me. There's enough light that will shine on all of us that it can be shared. And I think that was really an amazing statement she said that to me in 1988. 1988, and I still can hear her saying those words to me. And she said, she had no children, and she said to me, you are going to take care of my journal because my journal is my baby. And I have. And I had every job that you could imagine, every title, starting as assistant to the editor, and now I am the co-editor-in-chief of this international interprofessional journal, because I want to make sure everybody knows that when it comes to skin and wound care, you have to have people from different professions involved in it. I think the mistake that a lot of people make is they think that, like, for instance, and I probably will make some people angry with this statement, but I don't care, because what I'm going to say is true, that pressure injuries are not a nurse-sensitive indicator. They're a team indicator. I've written at least 2 editorials about this, and that even Florence Nightingale in Notes in Nursing wrote that if the nurse doesn't have the right administration, the right environment to nurse, don't be blaming the nurse if somebody gets a bed sore. That's the word that she used on it. That we really have to look at it from a systems approach. And I absolutely believe in that. And every system that I have changed is because we changed the system.
Thank you for sharing that, Elizabeth. Which segues also into my next area that I want to talk about. You are a prolific writer. Your CV. I had the job of helping Elizabeth cut her CV down when she was nominated for the Distinguished Alumni Award. And I think it had to be cut down to 20 pages.
I don't remember.
Whatever.
Some small number.
From some small number. And I called Elizabeth and I was like, help me. And I said to her, there's like 50 pages of your publications. I said, even if I just cut by date, there's still too many. I said, why don't you tell me which ones are most impactful? And Elizabeth, without looking at her CV, went through almost every publication going, this is important because, this is important because. I did after a while, Elizabeth, just cut off after the page number. And I'm like, well, this
Well,
is how we're
I
going to
can
do
answer
it.
the question if I only had to cite 3 manuscripts. I will tell you the 3 that I think have
Okay,
had the
which
most impact.
of the hundreds and why?
Okay,
Why
I
did you
think
pick those 3?
okay, I think the first one was on wound bed preparation, or WBP, which came out of an international consensus document, and I was one of 2 nurses. All the rest were physicians. And it was a time, now you need to remember, way back in the early 2000s, we really did not understand the biological underpinnings of why chronic wounds were not healing. We had a pretty good idea what was going on with acute wounds because they didn't get stalled, but we did not understand chronic wounds. So as research was starting to tell us that, we needed to translate that for the clinicians at the bedside. So we developed the wound bed preparation model, and I have to tell you that it's I think 25 years now. We continue to do research on it. We continue to modify it and make it a clinical decision-making model for clinicians to use. And the last version of it was just updated in April of this year. And as Fidel said, I did get the WCET journal translated into 5, it's in 5 languages. So if you know anybody who reads better in languages other than English, like Mandarin Chinese, French, Spanish, or Portuguese, you can go to the WCET website and you can read that article for free because we made the non-English ones open access. They are all free. So that was March of this year. Don't forget, it's WCETN.org. I'm not responsible for the weird website you might go to if you forget the N.
Now I'll have to try that website.
Yeah. So let me tell you the
Tell
other
me
one.
the other 2, please.
Okay, the other 2, which took longer than I really wanted it to happen, was the work that I started in the late 1990s, and we just updated it again because there's more interest in this topic in September of 2023, and that was to change the stage 1 definition of pressure injuries to be inclusive across the diversity of skin tones that humans have. And I'm very proud of this. And it came about because I was at a conference and I got up and I said, I work as a nurse in New York City, and your definition doesn't work for half of the patients that I take care of. So you need to change the definition. And what I found out is that when you call somebody on something, you need to be willing to then do the work. And because they put me in charge of the task force. But I am very proud of that. And right now, in the last couple of years, there's a lot in the literature now about everybody wanting to have better early detection of particularly pressure injuries, but other skin conditions in people that have skin that, the doctor who's co-edited with me is a dermatologist. So I have been having a lived course in dermatology since about 2002. And in dermatology, you know, they do a better job than we do in nursing, although they have some work to do also in educating people. So, you know, if you Google my name, those two articles will come up. I don't know if they're free access anymore, but if you belong to a library at work, they probably can get them for you. Because I am very proud of that. And then the third thing is my work with Centers for Medicare and Medicare Services, where I was able to change the MDS, which is an assessment instrument that nurses have to complete in long-term care, and to really bring the section on skin, which is section M, to really grapple with some of the problems that nurses see and are challenged with, classification, and specifically skin failure and lesions or ulcers or problems with people who are at end of life. And I was very happy that I was able to educate surveyors. And those slides are probably still up because when you do work for the government, they become your tax dollars in action. And that they have CMS recognized and validated definitions for unavoidable pressure injuries, as well as terminal ulcers, which are sometimes called Kennedy terminal ulcers, or Trombley-Brennan, as well as a concept of skin failure, which are very hot issues in my specialty right now. So I'm delighted that I was able to, in a very small way, help to influence some policy decisions from CMS.
Elizabeth, is there one piece of advice you would give to nurses who aspire to publish their research or insights?
Yes, first of all, I want to say that the very first article that I submitted was rejected. And if that happens to you, don't get discouraged. I mean, you know, I was upset, clearly. It wasn't the outcome I wanted. And I just, you know, it was so long ago that we weren't on computers yet, okay? It was typed, okay? That's how long ago it was. And I saved it. And sometimes you could just be ahead of yourself. And years later, the editor of the journal said to me, "Boy, I wish we had an article on such and such." And I said, "Oh, yes, you had it and you rejected it." And she said, "Oh, how do you know that?" I said, "Because it was mine." And she said, "Do you still have it?" And I said, "Well, you know, I'm an old nurse, so we always save things. Like you all saved my notes." So I said, "Yeah, I have it." I said, "I just have to locate it where it might be." And it got published. It did
Oh,
get
wonderful.
published. So you need to work in a team. Writing is a skill. It's kind of like, how many of you made resolutions last January 1st to go to the gym and work out every, you know, once a week or twice a week, or lose weight or whatever, okay? But if you don't schedule going to the gym, you don't go. And if you don't schedule writing, it doesn't happen. And I work best in a team. So I like writing with a group of people. And I find that that's more effective for me because we can resonate over each other in terms of ideas. So work in a team environment. And if you are in the clinical setting, look for somebody who's in academia, because people in academia need to publish, and they probably would be happy to work with you and have you join the team, because you bring an important perspective, and people who are researchers bring the research perspective, and people who are in academia bring the education perspective, as well as from an educational point of view. So, you know, we all need to work together. We all have something important to contribute. And I think we need to get out of the silos that sometimes we have.
Thank you. I couldn't agree more. So to wrap it up, what message do you have for the Meyers community?
I want to say that you can make a difference. okay? And the most important difference is to make it in the life of a patient. And whether it's your research that you've done, whether it's the students that you have taught or have taught you, because I remember a phrase from NYU that, and I forget who said it, but I think it was John Phillips, but I'm not positive because it was a long time ago in a galaxy far, far away. When you become a teacher, by your students you will be taught. And who's teaching whom? That is a reciprocal relationship that we all have together. And I think that that's a very important piece to remember. The other thing that I would want to say is that I came to NYU a long time ago when Martha Rogers was still teaching the course on unitary man. And the one thing that resonated with me the most was she used to say the whole was the sum of its parts. And I said, wow, she's a wound care nurse like me, because all I could think about was the wound is more than just the local wound bed. It's everything that's going on with the patient, mentally, physically, financially, their relationships with people. And that we should never forget that. And whether your difference is with a person, changing a system, changing a student's life, everybody has an important role, and we should be spending our lifetime trying to make things better for humanity.
Thank you, Elizabeth. Those are very important words. And Martha, wherever she is very pleased with you.
She's in the third dimension.
Yes.
She's in outer space, or I like to say the eternal care unit that she's doing. And the other thing, because I know it's probably
No, you're
Eastern
good.
time.
You're good.
I want to say two things about mentoring. I was mentored by my family, and they read me this book. Those of you, I saw some of you are probably my contemporaries. This is a book from a long, long time ago called Nurse Nancy, and it was all about a young girl who wanted to learn how to heal patients' wounds and practice bandaging and do things. And they read it to me because I was kind of floundering as a middle child and didn't know what I wanted to do in life. And they read me this book and it resonated with me. So it's never too young to mentor somebody and to get somebody, because nobody in my family was in healthcare or or a nurse until recently. And the other thing I'm very proud of is that my youngest daughter is a nurse, although you know, I was surprised when she wanted to go into nursing. And the very end of this book says, and I believe this is true, the last thing that she says in this book is, I'm certainly glad I'm a nurse. And I think that is, to me, some of my proudest moments have been when I say to people, I'm a nurse. I never say I'm just a nurse. I say I'm a nurse. And we all need to be proud of what we contribute to the healthcare system, whether it's where we work, whether it's in our community, whether it's in our country, whether it's in different parts of the world. I've been really lucky that I've been able to teach in many areas of the world, in South Africa for many years, in Abu Dhabi, in the Philippines. I even got a medal from the Philippine Air Force because we taught a course. I took a research project that I was sent to the Philippines to do and created a wound care course, which has run since 2012 in the Philippines, and introduced to the Air Force Nursing Corps how to do negative pressure wound therapy. And they gave me a medal. That's what's around my neck. Because by learning how to make negative pressure wound therapy when you don't have all the companies and in the field, because these were flight nurses in helicopters. And they sent me a picture of a soldier who now has his arm, still has his arm, because we in my faculty taught her how to use the equipment they had to stop the bleeding, get him to a like a MASH hospital, and how to make makeshift negative pressure wound therapy and save his arm. And you know, that's what we do as nurses. We heal people.
Thank you, Elizabeth. Your words are very, very inspiring and touching. So now we're going to open it up to questions. Please type your questions into the chat and we'll get to as many of them as we can.
You may have to, oh, okay, I see where the chat is on the bottom here.
You don't have to worry about reading them, Elizabeth.
Oh, okay,
As
you're
they
gonna read
come
them for me?
in, I will
Look
read
at all
them
these
to you.
wonderful, beautiful people that came on. Thank you so much. Oh my gosh, and I see somebody I went to school with. Is that Harriet Feldman that I know?
Yes, it is. It's my
Yes, it
former
is.
dean.
Hi,
Yes, we were in our
The
clinical nurse
Delphi.
at Delphi together.
Yep.
Yes,
Yep. Nice to see
thank
you.
you. And for those of you who do not yet have your PhD, I want to tell you that having the PhD opened up opportunities for me that were not available on the master's level. So, just never stop.
Thank you,
Never stop.
Elizabeth, for putting a plug in for PhDs. I agree with you. Does anybody have any questions they'd like to ask Elizabeth?
Well, you must have some questions. There's only 2 questions or 3 that I don't answer.
Okay, here is one. Do you have a favorite fun fact about skin or wound care?
Yes. The skin is the largest organ of the body, and it gets no respect.
True, true, true. Another question. Have you seen the field of nursing change over the years? And what do you think has been the most significant change in the profession?
Can I have 2 instead of only 1 significant one?
Sure, you can have as many as you like, Elizabeth.
Okay, so I graduated as a nurse in January of 1971. So you can figure out how many years that I've been a nurse. There were no critical care units. They were just coming into being. And the ability to do assessments on people was really very limited at the time. Particularly people with diabetes, we had to have test tubes, get urine and put tablets in it to find out what their glucose level was. And it was not very accurate. If you had color blindness, you couldn't read the strips because they were, which is a problem. So I have seen a real change in technology has helped us in terms of, I remember when chem strips came into being and glucometers. Hold on, my computer is telling me it's going to shut down, which would be a disaster. And I think in skincare, one of the things that's very interesting is that I believe that we will have even more and more better assessment devices to help us and take the objectivity out of it. And many of them are in testing. So, okay, hopefully. Yes, okay, now I
Okay, you
won't
good?
disappear. Yeah, so I think, to me, the ability for us as nurses to have technology to help us with our assessments is probably great. And in my first book, I said someday we're going to have gadgets like in Star Trek that we're just going to go like this down the people, and it's going to tell us what the wound is, what the depth is, what the length is, all these things. And now people have created them.
Yeah, pretty impressive.
Yeah, it really is.
Okay, here's a question. What
Oh.
advice or insights can you give to a PhD student on developing a program of research?
Um, hmm. Make sure it's something you love, because
Good
you're going to
advice.
spend a lot of time on it. And if you don't have passion about the topic, switch. Find something else, because you must love what you're doing. You must love what you, and even if somebody tries to change your mind, what it is that you have the passion on, stick to your guns and you will find a way.
Thank you, Elizabeth. And actually, you gave me that piece of advice when I was struggling in my PhD program. So that was a piece of advice that you gave me that has served me really, really well.
I think somebody
Okay.
wanted to know about, was it Abu
Abu
Dhabi
Dhabi, yes. Could you
or
tell?
South Africa?
No,
They
it's
go
Abu
by so
Dhabi.
fast that it's hard for me
Yeah.
to
No, I'll read.
read
Can you
them.
tell me more about your experience in Abu Dhabi?
With great pleasure. So, probably the most interesting country that I have been to um, was Iran. I actually went to Tehran, Iran, in April of 2007, 2 weeks after the British hostages had been released from the boat that somebody had taken over. Okay. And I've been teaching an international interprofessional wound care course out of the University of Toronto with Dr. Gary Sybil, who's my co-editor of the journal. And he asked me to come to Tehran because we were invited by he was the head of the Department of Dermatology. So I went. And that whole thing was interesting. Oh, are you still there?
Yes, we're still here, and you're still there, Elizabeth. It's okay.
Okay. Okay. Well, okay. And I met a nurse who came from Abu Dhabi. She's originally from Pakistan, but her husband had a job in Abu Dhabi, so she migrated there. And the last day of the course, she was crying, and she said to me, I want to see you again. And I said, okay, well, then what you need to do is create what your senior project was, which was to bring the course to Abu Dhabi. And then you will see me again. And we can stay in touch. Here's my email. You can correspond with me. And she did. And this woman changed skin and wound care. It took her 2 years to develop the course and to run. She has the longest running wound care course in Abu Dhabi in the United Arab Emirates, which, by the way, it's a great place to go on vacation. It's fabulous. The food is great. My criteria always is, how is the food? Because I'm of Italian descent, and the food is great, and the people are they're very kind to those. We're called Westerners when we go there, and amazing place to go to. And I go every year. In fact, I was there when the world shut down with COVID and got on one of the last flights before the airport closed, because we had just finished the course. And then she said to me, I one of the things that I did is I was the first woman to co-chair the World Union of Wound Healing Societies Congress, which is held every 4 years. And she said, you always told me that a mentor wants their mentee to outdo them. I said, absolutely. She said, so I figured out something I could do that you were not able to do. I want to be the first female and the first president of the World Union. Will you help me achieve that goal? And I said, of course. And I'm very proud that she did it. She did it. She's the only nurse, been all physicians, and the only female. And she's just changed skin and wound care in her country to do that. And she's wonderful. I talk to her probably every other week by WhatsApp and by email, and she's doing great things.
Very, very impressive, Elizabeth. Boy, the time went by quickly. We've come to the end of our program, and I'm going to turn it back over to Dr. Fidel Lim.
Yeah, thank you, Sharon. There's lots, Elizabeth, there's lots of interesting questions in the chat. And
If you want to send them to me, and if you have a mechanism to get them to people,
yeah.
I would give you answers if you wanted written, or if you wanted to do a Zoom call with me and record them and give people access, however you want to do it.
Yeah.
I'm open to all ideas. All ideas are
Janet's
good.
nodding her head, so we'll figure out a way, Elizabeth.
Okay. I'm
So,
happy. I'm happy to talk about skin and wound, and maybe you know somebody who would want to go on and get specialized knowledge in it.
mhm, mhm. It is really great. It's just like being back in your classroom, Elizabeth, when I was a 24-year-old nursing student in the master's program. I was dazzled by your skill. I mean, we're talking about before PowerPoint. We didn't have any of the, we have the transparency, it's the plastic one. I used to
Yes.
carry around a carousel of slides that you would have me carry there, and you and Carl. But it gratifies me a lot to hear your absolutely exquisite work that you continue to do all these years, and the community, the patients. Meyers is very, very thankful for you. And thank you, Sharon, for moderating. And one takeaway, I'd say, based on what you've told us tonight, is be the innovator that you maybe never thought about. So you certainly have done a lot specifically for skincare, and it's just fabulous work you continue to do. So thank you to our guests who attended tonight, and you will be receiving a survey later this evening. We encourage you to share feedback about the program. And from the bottom of my heart, Elizabeth, thank you so much for what you've done to me and to all of us at Meyers. And we will continue to learn from you.
Thank you,
We all learn
Elizabeth.
from each other. Thank you for this opportunity. Thank you so much.
Thank you. Have a good night, everybody.
Good night.
Good night.